Hello, welcome to EPG Pathshala. I am Dr. Sanjay Kumar Patel, Senior Resident at AIIMS, Department of Physiology, All India Institute of Medical Science, AIIMS, New Delhi. So, under the EPG Pathshala and under the subject Biophysics, this is paper number 03, Thermodynamics of Living System and Bioenergetics. I am going to tell about the module that is module 11, and title is Diathermy, Shortwave and Microwave and its use in surgery. So under the specific learning objectives, at the end of this module or the lecture, the students should be able to explain the importance of diathermy. The students should be able to describe in brief the various uses of diathermy. The student should be able to describe the various techniques of diathermy, and at the end of this module, the student should be able to explain the principles of therapeutic diathermy and also the surgical diathermy. So, this module will be described under the following headings, which is the overview of this module, and the headings are: first, introduction, then we will be talking about a bit of history of diathermy, then the uses of diathermy. Under the uses, there are physical therapy and there are surgical diathermy. And under the heading physical therapy, we will be talking about ultrasound, the use of shortwave diathermy and the microwave. Under the surgical use of diathermy, we will be talking about working the operation principles and the various effects of surgical diathermy, under what effects it works, and at the last we will summarize the whole module. So, to introduce the topic, that is diathermy, first of all, what is diathermy? In a simple word, it is the electrically induced heat, and to define the diathermy, it is the use of high frequency, usually that frequency is in the range of 300 to 3000 kilohertz, to induce the electromagnetic currents, and it is in the form of physical or occupational therapy and in surgical procedures. So, this is a brief introduction about diathermy. We have to give credit to Nagelschmidt, who discovered this technique way back in 1897. In 1897, this field was pioneered by the German physician Karl Franz Nagelschmidt. He coined the term diathermy. The word diathermy is made from the Greek word, the pair of Greek word dia and thermo, which literally means heating through. So diathermy means heating through, if you talk literally. And the most common use of this diathermy in today's scenario is muscle relaxation. And also this diathermy induces deep heating in tissues for therapeutic purposes. So to continue with the introduction, the diathermy waves are produced by basically three techniques. The first is ultrasound, that is called ultrasound diathermy. Shortwave, radio frequency is in the range of 1 to 1000 megahertz. Those are called shortwave diathermy. This microwave is typically in the range of 915 megahertz or 2.45 gigahertz bands. Those are called microwave diathermy. Also, we have some methods which produce this diathermy. The methods mainly differ from each other in their penetrating capability. The surgery diathermy is to use this diathermy to cauterize the blood vessels to prevent excessive bleeding. That is the most common use of surgical diathermy, and the technique is particularly valuable in neurosurgery and surgery of the eye, particularly the microsurgeries. So after briefly introducing the topic, and before going into the detail of the topic, we should talk about the history of the evolution of the technique called diathermy. Way back in 3000 before Christ, it is recorded the पहले ठीक था. So after briefly introducing the topic and before going into the details of the topic, we should know about the history of evolution of this technique. So to talk about the history, we should go to the 3000 before Christ, when it is noted that the Egyptians used heat for the treatment of various tumors. So that was the very primitive use of diathermy, you can say. In 460 to 370 before Christ, Hippocrates used heat for treatment of suprapubic abscesses. In AD 1, in year 1, Celsius used cautery for hemostasis, tumor ablation as a cutting instrument. But the present form of diathermy was first used in 1881 by William J. Morton, who applied the principle of electricity to the medical field. In 1891, Nikola Tesla, the famous physician, scientist, first noted the ability of high frequency currents to produce heat in the body and suggested its use in medicine. In 1897, the German physicist Carl Franz Nagelschmidt demonstrated the therapeutic use of high frequency current in articular and circulatory diseases and coined the term diathermy. To continue with the history, in year 1900, Riviere was the first to describe the destruction of small tumors with a high frequency current and healing of an ulcer with repeated application of low voltage current. In 1907, Doane introduced the electrocoagulation concept, and he was the first to pioneer the bipolar diathermy concept. Until 1920s, noisy spark discharge Tesla coil machines were used. These were limited to frequencies of 0.1 to 2 MHz, and these were called long wave diathermy. The current was applied directly to the body with contact electrodes, which could cause skin burns. In the 1920s, the development of vacuum tube machines allowed the frequencies to be increased to 10 to 300 MHz, called shortwave diathermy. So before 1920s, all the techniques those used diathermy were long wave diathermy. After 1920s, the shortwave diathermy was introduced. In 1924, Waite used shortwave method, and he popularized the method of electrodissection, particularly in medical uses. Now coming to the core topic of today's module, diathermy. So first we will talk about the various uses of diathermy. Broadly speaking, there are two uses of diathermy. One is physical therapy and another one is surgical diathermy. Physical therapy, it is the application of moderate heat by diathermy by either ultrasound or by shortwave diathermy. The shortwave diathermy again has two procedures, and that are continuous shortwave diathermy and pulsed shortwave diathermy. Another technique of physical therapy is microwave. Coming to the surgical diathermy, that is the use of high frequency alternating current AC electric current, and it has mainly two modalities, monopolar and bipolar, that we will talk in detail later. Coming to the first use of diathermy, that is physical therapy, and the first modality is the ultrasound. So first we will talk about the ultrasound. It utilizes the high frequency acoustic vibrations converted to heat. So the acoustic vibrations are converted to heat. This conversion is utilized by this technique. It is pretty useful in the delivery of the heat to selected musculatures and structures, because there is a difference in the sensitivity of various fibers to the acoustic vibration. Some of these techniques are more absorptive and some are more reflective. For example, in subcutaneous fat, relatively little energy is converted into heat, but in muscle tissues, there is a much higher rate of conversion to heat. So this ultrasound uses these variations among the tissues to cause its effect. Continuing with the ultrasound, the therapeutic ultrasound apparatus generates a high frequency alternating current which is then converted into acoustic vibrations. The apparatus is moved slowly across the surface of the part being treated as any other use of ultrasound. And this ultrasound technique, it's a very effective agent for the application of heat, but it should be used only by a therapist who is a skilled therapist who is fully aware of its potential hazards and the contradictions for its use. Coming to the second technique of physical therapy, that is shortwave diathermy, techniques of physical therapy. This is the application of high frequency electromagnetic energy that is primarily used to generate heat in body tissues. Body is placed within the electrical field and thus the body becomes a part of this alternating current that is generated from the shortwave diathermy unit. The shortwave diathermy is either a continuous mode or a pulsed mode. The continuous mode is called continuous shortwave diathermy and the pulsed is called pulsed shortwave diathermy. Depending on the form of shortwave diathermy, one can elicit a thermal treatment or a non-thermal treatment. Continuing with the physical therapy, in the shortwave diathermy method, the shortwave diathermy travels through the tissue generating heat. The heat is generated by the resistance of the passage of the energy through tissues. The non-thermal effects are elicited through repolarization of damaged cells and the correction of their dysfunction. The depth of penetration of shortwave diathermy is equal to or greater than ultrasound and greater than any infrared modalities. So this penetrating power of shortwave diathermy is used for the purpose of physical therapy. The main effects of shortwave diathermy are to increase deep tissue temperature. As the shortwave passes to the tissue, it increases the temperature, to provide vasodilation and increase the amount of blood flow to the affected areas. These electric currents usually penetrate 3 cm deep. The shortwave diathermy is best modality to use if goal is to increase temperature. So as we have talked, the shortwave diathermy is being used in the two forms. One is shortwave diathermy, continuous shortwave diathermy, another one is pulsed shortwave diathermy. So first talking about the continuous shortwave diathermy. It is based on two techniques. One is the capacitance technique and another one is the induction technique. Talking about first the capacitance technique, it creates a stronger electrical field rather than a magnetic field. So capacitance technique creates stronger electrical field. The organ is placed in between the electrodes and the organ itself becomes the part of the circuit. Thus, the tissues that provide the most resistance inhibit the amount of heat transfer to the body. So the most resistance tissue inhibit the heat transfer. So areas of the body that have lower amounts of body fat. So continuing with the continuous shortwave diathermy, we have the second technique that is called the induction technique. This induction technique creates a strong magnetic field and a lesser electrical field as compared to the capacitance technique. We have seen the capacitance technique creates a strong electric field and weak magnetic field, but this induction technique creates a strong magnetic field and a lesser electrical field. So it creates basically the eddy currents with small circular fields which act within the tissues. The eddy currents creates the small circular fields, and this field act within the tissue that causes heat generation. In this induction technique method, the organ is not the part of the circuit as we have seen in the capacitance technique, but the organ is a part of a parallel circuit where the current will flow through the tissues that provide the least amount of resistance. In the capacitance technique we have seen the tissues with higher resistance have a better role. Here the tissues having the lowest resistance have a better role. Now the second technique of this pulsed of this shortwave diathermy is pulsed shortwave diathermy or PSWD. It is the use of interrupted current instead of a continuous current. When continuous current is used, it is called continuous shortwave diathermy. Here we are not using the continuous current, we are using the interrupted current. That's why it is called pulsed shortwave diathermy. The interrupted current is sent out as a high frequency burst with short pulse duration. Thus, it provides the non-thermal effect with little to no sensory nerves stimulated. After discussing the various techniques of shortwave diathermy, that are continuous shortwave diathermy and pulsed shortwave diathermy, let's come to the most important topic or the most important part in shortwave diathermy, that is the indications of shortwave diathermy. That means where this shortwave diathermy can be used. Most commonly, this shortwave diathermy is used in joint inflammation. This shortwave diathermy is to be used with very cautiously because the deep heating produced by shortwave diathermy can cause destruction of the tissues, particularly the collagen fibers. Apart from joint inflammation, we have some other indications like large areas that cannot be heated through. In those areas we can use this shortwave diathermy. Other methods cannot be used because of the size of the area. One more indication is the condition of fibrositis, that is the inflammation of fibers, the fibrous tissue. Inflammation of fibrous connective tissue that surrounds the muscle and causes pain and stiffness. So in these conditions we can use shortwave diathermy to relieve the symptoms. Talking about some more indications of shortwave diathermy, myositis. What is myositis? It is the inflammation of muscle in the simple term. So inflammation of a voluntary muscle that is characterized by pain, tenderness and muscle spasm in the affected area. Since it is inflammation, all the cardinal features of inflammations are there. So myositis means inflammation in the voluntary muscle. We can use the shortwave diathermy to relieve the symptoms of inflammation. The next indication is subacute and chronic inflammation or some deep tissue layers. So apart from this myositis and fibrositis, we can use in some subacute and chronic inflammations also. Another use of this shortwave diathermy is osteoarthritis. In fact, the most commonly used indication. What is osteoarthritis? It is the chronic degeneration of the cartilage of the joints. So since the cartilage of the joints are degenerated over a long period of time, it causes pain and the swelling around the joints. So to relieve the pain and swelling, we use this shortwave diathermy. After talking about the indications where we can use this shortwave diathermy, we must know the contraindications of shortwave diathermy. Contraindications means those conditions in which we cannot use this technique. Here it is shortwave diathermy. So in the following conditions we cannot use shortwave diathermy. Ischemic areas. The first contraindication is the ischemic areas. It increases the metabolic rate, causing more hypoxia. If we use the shortwave diathermy in ischemic areas, it increases the metabolic rate and that causes the more hypoxia to the tissues. In peripheral vascular disease like Burgess disease also, we cannot use this shortwave diathermy. If there are metal implants or permanent jewelry worn by the patient or the subject, we cannot use the shortwave diathermy. So to use shortwave diathermy, one important precaution is to remove the jewelry whatever the patient is wearing. If the jewelry is permanent or like some piercings, and if the patient is having any implants in his or her body, metal implants like in orthopedic, in knee implant and hip implants, we cannot use this shortwave diathermy. Another contraindication is perspiration and moist dressings. If the patient is wearing some moist dressings, we should not use this shortwave diathermy, as it may cause the short circuiting in the conducting circuit. Also, if the patient has any tendency to hemorrhage, like if he or she is suffering from any bleeding disorder, then this shortwave diathermy technique is best avoided. In fact, during menstruation also, we should not use this shortwave diathermy, as the menstruation is a condition in which there is active bleeding and also there is a tendency to hemorrhage, so we should not use the shortwave diathermy in those patients. In cancer patients also, shortwave diathermy should not be used. And in fever, although fever is a feature of inflammation, but if the fever is profound, the shortwave diathermy cannot be used. It should be used only in case of pain and swelling. There are some more contraindications adding to the previous list that I have talked. Sensory loss. If the patient is suffering from sensory loss, we should not use the shortwave diathermy. We have talked about the metal implants. If the patient is having any metal implants, the shortwave diathermy is contraindicated. Also, in the cardiac pacemakers is being used by the patients. In some patients, they use the pacemakers, the artificial pacemakers. In those patients also, we should not use the shortwave diathermy. In pregnant ladies, we should not use the shortwave diathermy. The shortwave diathermy should not be used at the epiphyseal plates, particularly in children, as it is the growing end of the bone. It may harm the growth of the bone. Also, the shortwave diathermy should not be used in the area of genitals. Also should not be used at the eyes or faces and face. The shortwave diathermy should not be used directly at the site of infection. If there is wound or any injury or infection to the infectious site, the shortwave diathermy should not be used there. And also, if the patient is having any implant like intrauterine device, if the abdomen with implanted IUDs, we should not use the shortwave diathermy particularly in the abdominal area. Coming to the setup of the shortwave diathermy. What are the setups of shortwave diathermy? Two condenser plates is used. The two condenser plates usually placed on either side of the organ to be treated. So the organ comes in between the two condenser plates. Another mode of the application is by induction coils that are flexible, that can be molded to fit the part of the body under treatment. Either we should use the two condenser plates or a molded induction coils. As the high frequency waves travel through the body tissues between the condensers or the molded coils, they are converted into heat. So currents travels from one condenser plate to another condenser plate and through the tissues, and while traveling through the tissues, they generate and the high frequency waves are converted to heat. So continuing with the setup of shortwave diathermy, the degrees of heat and depth of penetration depend in the part on the absorptive and resistance properties of the tissues. So more the resistance and the absorptive power of the tissues, more is the heat that is generated. Shortwave diathermy operations use the band frequencies of 13.56 or 27.12 or 40.68 megahertz. So these three band frequencies are being used for the shortwave diathermy. Most commercial machines operate at a frequency of 27.12 MHz with a wavelength of approximately 11 meters. The other two frequencies, that are the 13.56 and 14.68, are now used for the research purposes. Coming to the third modality of physical therapy of diathermy, that is microwave. What are the microwaves? These are the radio waves with high frequency and shorter wavelength than the short waves. So these are microwave because their wavelength are shorter than the short wave that we are talking about. The frequency being above 300 megahertz, because these have the low wavelength, they have the high frequency and a wavelength of less than 1 meter. Most of the therapeutic effects of microwave therapy are attributed by the conversion of energy into heat and its distribution throughout the body tissue. Continuing with the microwave, this mode of physical therapy of using diathermy is generally considered to be the easiest to use, but they have a relatively poor depth of penetration. Microwaves cannot be used in high doses on edematous tissues as they are being used, as the shortwaves were being used, over wet dressings or near metallic implants, as like in the shortwaves. In the body, because of the danger of local burns. Like shortwaves, these cannot be used on or near persons with implanted electronic cardiac pacemakers. So more or less, the contraindications are same in the shortwave and microwave. So continuing with the microwave, some peculiarities of microwave we shall discuss. It induces the hyperthermia that raises the temperature of the deep tissues from 41 degrees Celsius to 45 degrees Celsius using electromagnetic power. This microwave diathermy, this mode of treatment at 434 and 915 megahertz can be very effective in the short-term management of the musculoskeletal injuries. So it has a two frequencies, 434 and 915 megahertz, that is being used. The microwave diathermy induced hyperthermia produced short-term pain relief in established supraspinatus tendinopathy. So this supraspinatus tendinopathy is a commonly used indication for this microwave diathermy. This microwave diathermy is also used in the management of superficial tumors with conventional radiotherapy and chemotherapy. So along with the conventional radiotherapy and chemotherapy techniques, the superficial tumors can be managed by the microwave diathermy also. Hyperthermia that is produced by the microwave diathermy has been used in oncology in addition to radiotherapy in the management of different tumors. Coming to our second but most important use of this diathermy, that is surgical diathermy. The surgical diathermy is also known as electrosurgery or occasionally as electrocautery. It involves the use of high frequency AC electric current in surgery as either a cutting modality or else to cauterize the small blood vessels to stop bleeding. So it has commonly two uses. One is the cutting modality, another one is the cauterization of the small blood vessels that cause the bleeding, to stop the bleeding. This technique induces localized tissue burning and damage, the zone of which is controlled by the frequency and power of the device. The surgical diathermy that is being used, it is of two types: unipolar, or we call it monopolar, and bipolar. So as the name suggests, monopolar diathermy, it is the electric current, when the electric current passes from one electrode near the tissue to be treated to other fixed electrode. That fixed electrode is commonly placed at some other places in the body. It is often called indifferent electrodes and it is placed elsewhere in the body. The second technique is bipolar. Both the electrodes that is being used in the bipolar diathermy are mounted on the same pen-like device called diathermy forceps that is held by the surgeon in his hand, and the electric current passes only through the tissue being treated. Advantage of bipolar is it prevents the flow of current through other tissues of the body and focuses only on the tissue that is in contact with the cautery, or we call it diathermy forceps. This results in greater accuracy, safety, and with the less tissue damage. This is useful in microsurgery and in patients with cardiac pacemakers also. As we have seen, the other forms of this diathermy are contraindicated in the patients having cardiac pacemaker. Unlike those, this monopolar and bipolar diathermy are not contraindicated. They are being commonly used in the patients having the cardiac pacemakers. This monopolar and bipolar diathermy are useful in performing delicate procedures involving neurosurgery, ophthalmic surgery, plastic surgery, and some microsurgery also. But major drawback of bipolar diathermy is it has very low power, which renders it useless for cutting purpose. So for cutting purpose, the bipolar diathermy is not used. For cutting purpose, most commonly the monopolar diathermy is used. But for any other purpose like to establish the hemostasis or to stop the bleeding, the bipolar diathermy is used, as the accuracy and safety are better in the bipolar diathermy, as well as the tissue damage is less in the bipolar diathermy as compared to the monopolar diathermy. Here in this diagram, we can see this is the monopolar passage of diathermy current through the patient's body. The active electrode or the cautery is held with the surgeon's hand, that is used for the purpose of diathermy, and the reference or the indifferent electrodes is placed elsewhere in the body. So with the help of this active electrode, the current enters to the body, and with the help of this from the indifferent electrode, the current goes back to the diathermy machine. This setup is the use of bipolar diathermy. This shows the bipolar passage of diathermy current. The two poles or the two prongs are being showed in the figure. With one prong the current comes, and with the other prong the current goes to the diathermy machine, and the tissue with which we tend to stop the blood or we try to establish hemostasis by occluding the bleeding arteries is being held with the help of this bipolar diathermy forceps. Now we will talk about the operative principles of this surgical diathermy. The surgical diathermy produces radio frequency of range 300 kHz to 3 MHz. It is an alternating current, and the patient's body forms the part of the electric circuit as in the other techniques of the diathermy. The active electrode is always small in contact area, which leads to the concentration of heat in the immediate vicinity. It is always small, the end is always pointed. This surgical diathermy works by producing the desired effects, and the desired effects are basically 4 effects. Those are coagulation, fulguration, or that is called dissection. Depending on the intensity of current. There are 3 techniques, the 3 desired effects. Those are coagulation, fulguration, and dissection. Talking one by one, first the effects of surgical diathermy. Talking one by one is first is the coagulation. This coagulation is achieved by direct application of heat via an active electrode to the bleeding vessel, causing coagulation of the blood proteins, drying out the vessel wall cells and hence shrinkage and retraction of the vessel ends, aided by the mechanism of thrombus formation. The second effect of surgical diathermy is fulguration. It is nothing but the destructive coagulation of the tissues with charring associated with sparks that create the spark sounds, resulting from a higher intensity current passing through the tissue. It causes extensive coagulation and necrosis of the tissue that is in contact with the cautery. This fulguration effect is used for coagulation as well as destroying small growths in the bladder or rectum. The third and one of the important effects of surgical diathermy is dissection or cutting. An electric arc is used to incise tissue and cauterize the divided surfaces at the same time. Smooth sine wave is passed through the tissue, producing a very hot cutting arc and resulting in a bloodless field during surgery. So, these are the three effects on which surgical diathermy works: coagulation, fulguration and dissection or cutting. For the purpose of coagulation and fulguration, the bipolar diathermy is used, and for the purpose of dissection or cutting, the monopolar diathermy is used mostly. After we have talking about the various uses of diathermy, the various techniques of diathermy, we have seen the use of diathermy in physical therapy, we have seen the use of diathermy in surgical procedures. Let's summarize the today's module. Diathermy, it is the electrically induced heat having high frequency, that is in the range of 300 to 3000 kilohertz, electromagnetic currents as a form of physical therapy and in the surgical procedures. Diathermy is commonly used for muscle relaxation, to induce deep heating in tissues, for therapeutic purposes in medicine, and is also used in the physical therapy to deliver moderate heat directly to the pathologic lesions in the deeper tissues of the body. Diathermy is produced by three simple techniques: ultrasound, that is the ultrasonic diathermy; shortwave radio frequencies in the range of 1 to 100 megahertz, that is called shortwave diathermy; or microwaves, typically in the 915 or 915 megahertz or 2.45 gigahertz bands, that is called microwave diathermy. The methods differing mainly in their penetrating capability. In surgical diathermy, it is used to produce basically three effects: coagulation, fulguration and dissection, to cauterize the blood vessels to prevent excessive bleeding, destroying all small growths, and to incise tissue and to cauterize the divided surfaces respectively. Thank you.